So my name is Coughlan. I'm a program manager at the Health Foundation. Thank you, Alice, for inviting us. We're an independent charity committed to bringing about better health and care for everyone in the UK. And in my role as program manager, I run a portfolio of funding programs, projects and initiatives that seek to improve the use of data analytics in the health and care system. And I'm thrilled to be talking to you today about what we think good social care analytics looks like, and also to give you an overview of our newest work, which will see innovative projects up and down the country receiving funding to test out ways of improving and strengthening social care analytics. So first up, how did we get here? Of course, earlier this year, the pandemic focused national attention on the challenges faced by people who need social care, those that use social care and that commission and deliver social care services. And unfortunately, the efforts to respond to the crisis were hampered really by the lack of detailed, actionable and accessible data about social care. So we began by hosting workshops and sort of consultation exercises with Future Care Capital, which my colleague Josephine is working for. And those workshops really brought together all sorts of different people. So those that use social care services, their carers, care tech developers, local authorities, researchers, and lots of people in membership bodies as well for frontline staff. And our participants came from kind of all over the UK, from both kind of domiciliary care as well as those who are kind of self-funding and residential care. So we were able to bring together a really fantastic, diverse group of people. And, these workshops really threw into sharp focus the complex challenges faced by the sector. And we kind of distilled these challenges down to just three. So improving the quality of social care for those cohorts of people that experience the worst outcomes, building a safe and resilient workforce, and finally, understanding the lived experience of people that need social care. And so we set up a funding program, we designed a funding program that we hoped would be able to fund projects that could address these challenges and show how good social care data analytics could really push forward and advance the way that care is delivered. So the aim of this funding program is here. It's kind of to fund exemplar projects that demonstrate how good data analytics can improve social care, but crucially to kind of help catalyse further change. And we're going to be doing that through the community of practice, which Josephine will speak a little bit more to in a moment. So I thought that perhaps I would break down that aim into, what do we actually mean by that in practice? So we speak about wanting exemplar projects to demonstrate good social care data analytics. And so for us, we kind of thought that meant good public sector and service user engagement. And I think really this speaks to sort of an open culture of shared understanding and really valuing the perspectives of those people that need and use social care services. The workshops, highlighted a real kind of difficulty in kind of trust and, some disincentives. And so it's really crucial that we bring that together. We hope that each project, of course, will be having strong analytics teams able to, link the necessary data and apply robust analyses. And finally, we think that underpinning this should really be a digital and data infrastructure that enables safe, ethical access to researchers, analysts, and developers. And finally, with those final points about catalysing further change, sharing in the community of practice, it's really, really important to us that any work in this space helps catalyse that change elsewhere. So these projects will be looking to share their findings, their methods, their code, and they'll be doing that through our community of practice. So where are we now? I've spent this entire week Zooming across the UK, speaking with lots and lots of different talented organisations, and we'll be selecting the successful projects next week. So they'll be announced next year, and they'll begin in March to run for about 12 months. And we'll be working on making sure that we share their progress, but they'll be sharing their methodologies, their findings, their code, as I've said, through that community of practice that we're developing with Future Care Capital. So I hope that our vision of good social care analytics chimes with yours. But if there's an element really that you think requires more thought or focus, then we'd love for you to come and get involved with us. So Josephine, who will be speaking in a moment, will be speaking about how you can get involved and what we'll be doing with the community of practice to engage many more people than just those who have received funding through our Strengthening Social Care Analytics funding programme. That's really all I have to say. So thank you so much for listening, and I hope you enjoy the rest of the day.